As we said, Election Day comes in the middle of a surging public health crisis. On Saturday, more than 86,000 new cases of coronavirus were reported. Those come in a week that has seen record-breaking daily numbers here in the United States, with nearly 600,000 new cases this week alone. In Europe, leaders are taking extreme measures to slow the spread in their countries. British Prime Minister Boris Johnson announced the UK will enter a nationwide lockdown next week for nearly a month. France and Germany among the other nations taking similar steps. Let's bring in Dr. Nahid Bhadelia. She is an infectious diseases physician and the medical director of the Special Pathogens Unit at Boston Medical Center and an NBC News contributor. Dr. Bhadelia, it's good to see you as always. So I just laid out all those very troubling numbers right now. You're so good at giving us a clear-eyed public health physician's perspective on where we are exactly, devoid of the politics. So what is your assessment of the state of coronavirus in America?
Good morning, Willie. I'm frightened enough just to give you a personal anecdote. I sat down with my parents last week to have a conversation about what I see potentially as the beginning of this surge, right? We see these frightening numbers, but what's even more frightening is that in most states, this is the beginning of their third surge. And we're starting off at this very high point where in October, 47 states saw increases in their hospitalizations. And over the next month, with things like Thanksgiving, potentially, students traveling back home, families gathering, we're going to see an increased surge combined with the cold weather, which of course, pushes the cases. But I do want to make one point. I don't want, the cases will increase. The amount of cases increasing will depend on us. I don't want to leave people without that hope because Americans are making two choices this week. They're choosing the person at the poll, right? And they're choosing their personal activities. And both of those are going to have an immense impact on the trajectory of the pandemic. So if we put on that mask and we do that physical distancing and we don't, invite the extended family this year to Thanksgiving, we could make a huge impact in cutting down those number of cases.
Yeah, we just saw in Europe now getting very serious once again about this, a national lockdown being put in place in the UK, Germany, and France doing their own versions of that as well. So from your expert position, what do you think needs to happen as of today to avoid a potential disaster through the winter?
Yeah, Willie, I think there's three aspects to our response that have really hurt us, right? These are just disorganization in the way that states are all dealing with this problem. They're dealing with it, different policies. The disinformation, as you said, the fact that we've lost a percentage of our population to not follow those simple measures, such as wearing a mask, because it's been so politicized, And the third is division. We haven't been able to pass things like the new COVID Relief Act, which would then allow states to push businesses a little bit further about rolling back those activities when they need to be rolled back, because there's no support for them to be able to do that. Of those, the most important, I think, we hope soon is this disinformation, including the disinformation that we sometimes hear from this administration about the fact that cases are going away, which of course we all see there are not, and the deaths going away, which of course we all see are not. If we can get everybody united for one action, which is bringing those cases and numbers down, I think we can get to the other side of this.
And as you say, there may be good news coming on a vaccine, but a lot needs to happen in the time before we get there. Dr. Nahid Bhadelia, thank you as always for your expertise on this. We certainly appreciate it.